Okay, so a very good afternoon, students, ladies, and gentlemen. I am Rajesh, an integrated nursing scholar, and I'll be the MC and the moderator for today's session. So, once again, I would like to welcome all of you to today's session titled Charting Your Career Path in Nursing and Allied Health. So, I'm honored to be introducing our panel of guests today. So, in this session, we have Miss Veronica, an advanced practice nurse from Alexandra Hospital. So, maybe a quick wave. Yeah. Next up, we have Ms. Shu Fen, an advanced practice nurse and nurse clinician from Yishun Health. We have Ms. Tan B.E., the Deputy Group Director of Allied Health at Sing Health and the Director of Allied Health at Sing Health Community Hospitals. And last but not the least, we have Mr. Clement, a Senior Occupational Therapist at St. Luke's Eldercare. Okay, so in this session, you will hear from our senior healthcare professionals share about their journey in the healthcare sector. So after their sharing, we will proceed with the Q&A segment, and you may post your questions via the QR code that I'll be showing in a short while, or you can raise your hands during the Q&A segment and we will take your questions accordingly. Yeah, here's the QR code. You all can just scan it and just keep it on, on standby on your phone. So later during the segment, we will take some of your questions through Pigeonhole. Okay, or alternatively, if you're not too shy, you can just raise your hand and we will take your questions. So we'll have colleagues going around to pass you the mic to just, ask your questions. Okay, so just maybe like a few more seconds. Okay, so without further ado, we would like to invite our guests to give their sharing. So first up, we have Miss Veronica. Please, yeah.
Hey everyone, good afternoon. I'm Veronica. Give me a second. Oh, I'm Veronica. I'm from Alexandra Hospital. Today I'm going to share a little bit about myself and AH in totality. Yeah. So I'm an advanced practice nurse clinician. I've been in service at about 17 years. Currently now I am specializing with nephrology, which is renal medicine, kidney medicine, and also general medicine. I am also the chronic program nurse lead in Alexandria Hospital. So what is chronic program? It's basically in AH, we have 5 main pillars of programs, which is be better, get better, live better, cope better, and age better. So these are all pillars of AH. And like I've mentioned, some of you I met earlier on, AH is like a sandbox. We're trying different modalities of care, pushing boundaries to see what healthcare can be like in the future. So live better, we primarily focus on chronic disease management and how we can actually keep patients in the community and best streamline care across the continuum from inpatient, outpatient, all the way to the community. Over to the corner at the side there, we have AH. That is our colonial building. AH is very rich in history. I'm sure some of you have read from all the way back, from the wartime all the way till now. A little bit haunted, but still a very great place to work in. Okay, I work in Ward 10 and 11 as well. Oh, wait, before I say that, besides being a little bit creepy at night, in the daytime it's extremely beautiful. We have lush greeneries, we have a lot of chickens running around, we have civet cats. If you want to copy luwak, also can. I need to go and trace the coffee, okay? Very nature, we are trying to keep the colonial facade there as also part of the UNESCO planning as well. So I'm also part of the Ward 10 and 11 nurse clinician. Ward 10 and 11 is basically an innovation ward, an integrated general hospital ward, whereby we actually utilize and embark on technological advancements and journey for our patients. So it's a new ward, extremely beautiful. There's aircon, yay. But of course, the temperature is set in a way that is, eco-friendly. So other than that, we have even though it's a C-class ward, our beds are all in a modular setting, whereby it's only one cubicle for a patient. We also embark in smart technology, such as smart beds, robot rounds. So we have robots to actually conduct rounds for patients who are on contact precautions. And also we have robots to help take vital signs. Things that are very mundane for the nurses. Still a nurse's role, but how can we then use technology to help us, take off some time to actually let nurses focus on what nursing truly is. Yeah. These are my team members. I'm sure some of you have met Doreen earlier at the booth. These are 10 and 11 nurses, and these two are my renal physicians who have been very pivotal to my growth as an APN. So this is my journey. Over here are my classmates. I just graduated from my master's not too long ago. I started off as a healthcare assistant. I finished my diploma in NYP, and then while waiting for my license, I actually worked as a healthcare assistant. And subsequently, I went to an orthopedic ward because I thought bones was very cool, very in, until I had to set tractions, and then I thought, okay, maybe something else might be better for me. I had an opportunity after that given by the hospital to actually advance my studies in advanced diploma in medical surgical nursing. And that opened my eyes to what nursing really truly is, because it's beyond bones, right? It's more about the complexity of care that we render for patients. And that actually blew my mind, because I felt that as a nurse, I can do so much more than just setting tractions per se, for example, or even wound management. I play a part whereby I can actually make a change in my patient's life, for example. Subsequently, I did my degree, and I had the privilege to go over to Alexandria Hospital because I was very inspired by the fact that I did not want to be confined into one discipline alone. I wanted to do more than just, say, for example, gastroenterology, for example. So after that, I went to AH and I got my master's, and now I'm very happy with where I am. I am an advanced practitioner in general medicine. So general medicine, I see patients with chronic diseases or any form of acute medical conditions. And also my new passion, which is renal medicine. As we know that, chronic diseases is getting more rampant in Singapore. Younger patients are getting chronic diseases. And unfortunately, kidney disease is one of those conditions that is a consequence of poorly controlled chronic disease. And I was just sharing with Shufan earlier on when you hear from her that how my role as an APN, as a nurse, and my physicians and my team actually reduce the readmission rates for patients with chronic diseases from the hospital. If we know a little bit about chronic disease, CKD, chronic kidney disease management, this group of patients get readmitted to hospital easily 4 or 5 times a year. And that is very taxing on the healthcare system and also in the community as well. And with the program that I'm doing currently now in AH, in Alexandria Hospital, I actually minimize that readmission rates down to at least minimum 1, or in fact, some of them 0 readmissions over the past 2 years. So that itself is as a testament to how excited I am for the future of AH and general medicine. So these are some of the awards. I had the opportunity to get some of the scholarship awards from AH in-house and also from cluster support programs such as Masters of Nursing and also a nurse leader program, which I'm currently in as well. So there's in-house awards as well. So the in-house awards recognizes your contribution as your career, in the healthcare sector as well. So as an advanced practice nurse, my role primarily is very much patient care. This is just the tip of the iceberg. There's much, 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 much more that we do. But in general, we actually manage patient, we care for patient, we embark on research as well. Like, for example, currently now I'm ongoing about 2 or 3 research at this time, and we actually play a part, in changing the landscape of healthcare when you participate in research. I educate my nurses. I also sometimes spend time in NUS educating my nurses as well there, and also to ensure and maintain clinical standards, because our workforce is the largest, and also we cannot dilute our standard of care because of the large number of people we have. So standards must be in place. And on top of that, as a program lead, I collaborate with, I collaborate with many stakeholders to actually ensure service sustainability, to ensure that there is a clinical nurse-led service for our nurses. So for example, we have many clinic nurses who are actually just registered nurses running clinic, running service. So this is something that we can actually grow the nurses in, We also have many chronic disease education across the sector, so inpatient, outpatient to the community. We also work with community partners to actually give chronic disease talks for the patients as well. So nursing is not just, in the hospital or let's say in an institution, it's more than that, yeah? That's all for me. So before that, so why did I choose nursing? It's a calling, it's a passion. I've always wanted to be a nurse since young. And I didn't have the funding to do so. So I was very fortunate enough that, NUH at that point of time have actually sponsored my education. And 17 years on, I'm actually here I am where I am today. So it's a career that is always giving. I was joking with some of the participants earlier on. I said, it's giving you a lot of, opportunity to grow, opportunity to learn, or gives you a sense of satisfaction, but it also gives you a lot of stress and anxiety. But that's expected in all careers, and it's something that grows you as well. So why do I do nephrology? Because it was really a wake-up call in chronic disease management. My dad passed on from a heart attack very suddenly, and if I have taken on this role much earlier, and if I knew that I could make a difference, I always wonder if that difference could have saved my dad's life. That's one. Two, subsequently, after my dad passed on, my mother had the 3 chronic diseases. Then again, I've seen how well she has controlled it, and I also know that she can have a quality-filled life with very well-controlled chronic disease. And that actually spurred me on to want to do more for chronic disease management. And why renal medicine per se? Because when you have kidney disease, basically you have a lot of chronic disease, and I feel that if you can manage your kidney disease well, it means that you can manage your chronic diseases very well as well. And the complexity of care is so complex that, and yet it's so interesting at the same time. Yeah, so I think that's all for me. Thank you very much.
Okay, thank you, Ms. Veronica, for your wonderful sharing. So next, we'd like to invite Ms. Shufen. Yeah, Ms. Shufen, please.
Hello, everyone. I'm very happy to be here today to share about my nursing journey. I'm Shu Fen, and I'm an advanced practice nurse working in Khoo Teck Puat Hospital, Yishun Health, and my area of specialty is in the community. So I started my nursing journey in NUS, where I was offered the institutional scholarship. In fact, nursing was my very first choice. And once I graduated from NUS, then I started working in the inpatient wards, where I developed my foundation in my nursing knowledge and skills. So I was there for about 2 years. And while I was working in the inpatient wards, I was also given the opportunity to be part of the nursing research unit, where we help to promote evidence-based practice for the hospital to improve patient care. I was also very lucky because I was given a lot of support and resource from the organization to publish in international research and also speak in overseas and local conferences. And I was also a part of several media campaigns to promote nursing in general. So after working in the wards for about 2 years, I was offered the opportunity to go into the community sector. In the community, it is a little different from working in the hospital. The model of care is a little more nurse-led, and you have to be able to think on your feet and be a bit more independent than working in the hospital. So what are some of the things that we do? We basically do home visits to patients with advanced frailty, patients with multiple complex chronic conditions. These patients tend to have recurrent admissions like what Veronica has shared earlier. And so what we do is we support them while they are in the community after their hospital discharge. We assess and monitor their conditions closely. We provide treatments and perform procedures in the community setting. And more importantly, we educate and support the patients and their caregivers and empower them to take better care of their diseases so that you do not fall sick often and have to come back to hospital because of the frequent deteriorations. So in a sense, we keep these patients well in the community. Yeah. So just to sidetrack a bit, in fact, nursing is a very dynamic profession, and there are many tracks to pursue your interests. There is the nurse manager track, okay, where primarily the responsibility is with manpower resourcing, planning, job evaluation, writing policies. There is also the nurse education track, where you can be in the academia area, where you can be a lecturer in the polytechnics or in the universities. There is also nurse education track within healthcare institutions where you will be involved in training and developing nurses. Then there is also the clinical nursing track, which Veronica and myself are in. So our focus is more on seeing patients, managing their acute and chronic illnesses. At a more advanced level, then you can be an advanced practice nurse, which is what I am currently and what Veronica is also. Then there is also, lastly, the nursing research track, where you can get to be a part of, to initiate and champion nursing researchers and facilitate the research efforts of nurses with the relevant healthcare partners. Yeah, so eventually I chose the clinical nursing track because I enjoy seeing patients. I enjoy being in the clinical track. Yeah, so I was very lucky to be offered the opportunity to be an advanced practice nurse in the community after being working in the community sector for about 3 years. To be an advanced practice nurse in Singapore, you do have to have a master's degree, and I pursued mine in NUS under the MOH scholarship, and I obtained my license successfully in year 2021. So as advanced practice nurse in the community, you are regarded as like a clinical expertise in the area that you are in. We do, because of our educational background, we do have advanced clinical knowledge and the capacity to make diagnoses, order investigation, order medications, make medication adjustments, etc. And in some cases where a doctor and nurse is required to visit a patient, I can actually manage and see the patient myself. So I help to save costs for the patient. I help to improve efficiency also. And because of my experience and my clinical background, I'm very happy to be able to teach and train my fellow nurses and guide them. Yeah. And also because of my experience, I am very happy to also be a part of research projects that aims to help enhance our clinical practice so that we can better patient care. So I also contribute at a more macro level in that way. Yeah. So as you can see, nursing is truly a dynamic profession. Yeah, you can really pursue your interests in various ways. Yeah. Thank you for listening.
Thank you, Ms. Shufen. Yeah, next, we'd like to invite Ms. Tan Bi to give your sharing. Ms. Tan, please.
Thank you. Thank you. Hi, good afternoon, everyone. I'm BE, and I'm from Sing Health, right, which is the largest public healthcare cluster in Singapore, with many institutions ranging from general hospitals, for example, SGH, to national centers like Eye Center, Heart Center, to community hospitals where I'm working, which I will share a bit more later, and also the Sing Health polyclinics. So I'm not going to talk very much about Sing Health and the institutions. We have a booth outside, right? So please visit our booth, and our colleagues there will share more with you. So I thought I will maybe share with you, my journey, how I started on healthcare. So like yourself, and this is, maybe like 30 years ago, after my A-levels, right, then deciding, what do I want to do? And of course, applying for a scholarship, right, is something very attractive. So then it's, what scholarship should I apply for? And I was seriously thinking about teaching, because my mother was a teacher. Of course, she's retired now, right? So that was my first choice, right? A teaching award. And we have to fill out other choices as well. And then I was thinking, what else should I put? And then, something came to my mind, physiotherapy. And you may ask, why, did I think of that? So incidentally, Veronica, that Alexandra was where I first encountered physio. Yeah, because my brother, being mischievous young boy, fell in school, broke his arm, and had to go to Alexandra for physiotherapy. All right, after his arm came off the cast and was stiff, and so had to go for physio to regain the movement. Yeah, so that was my first encounter with physiotherapy, and I thought, okay, I'll put down as one of my choices. Then I went to the panel, right, of the interview, right, with the panel in front of me. And then they said, actually, we have enough bio teachers. I mean, because I shared with them that if I become a teacher, I want to teach biology. And so they said, oh, we have enough bio teachers, but we don't have enough physios. So why don't you consider taking up physiotherapy? And I thought, okay, why not? All right. And that was how I started. So I went to London to do my physio studies, 4 years, came back, got posted to SGH, where as a young physiotherapy, and at that time, we only had like 20 physios. By the time I became head of department of SGH physiotherapy, we had 200 staff. Yeah, so really the profile, the need for physiotherapy and allied health in general has grown over the years and will continue to do so. So I'm sure if you ask the interviewers, right, who spoke to me that time, right, it's not about not enough physios, but we need more. Okay, yeah. And okay, so and in SGH, I had the opportunity, right, of course, to do clinical work. Also had chance to do research and teaching. In my teaching experience, I managed to also go to Cambodia, right, to also share our skills and knowledge with the physios there. Yeah, so so really education, is another way you can develop yourself in the profession. And then, and I also had an opportunity given the MOH HMDP award. So that stands for Healthcare Manpower Development Program. Went to Australia, spent a couple of months there to learn more about ICU care, because that is my area of specialization in physiotherapy, right? Working in the ICU with patients pre and post surgery. Yeah, so physiotherapy is a profession where there are many specializations: orthopedic, neurology, you name it. And then after maybe a few years into practice, I decided, okay, I want to learn more, and then I went to do a management master's. So that kind of set me on a path to take up more admin duties. And one thing led to another. Then I was given the opportunity to head the physiotherapy department at SGH. Did that, for a number of years. And then in 2017, I was then asked to join SingHealth Community Hospitals. At that time, SingHealth had one community hospital, and that's at Bright Vision, which is a COVID facility right now. And we were opening two other community hospitals at Sengkang and Outram. Yeah, so I was asked to go over and set up the allied health services. Yeah, so that was a big opportunity for me, but also filled with apprehension, because I only knew about physio, right? Yeah, from a single profession to having to set up allied health services at the community hospitals. So that's not just physios, that's also occupational therapists. We'll hear from an OT later. Speech therapists, pharmacists, dietitians, medical social workers. Yeah. But I had a good team of managers, and so together we set up the allied health services at the SingHealth community hospitals. And then, like I said, one thing leads to another. So I think the whole idea is that be open, right? Be open to opportunities that are presented to you. So, right, so after that, I was then asked to take up a portfolio at the SingHealth cluster level, right, in the SingHealth Allied Health, looking after the academic and professional development portfolio. So what does that portfolio cover? So in SingHealth, we have 31 different allied health professions. So the bigger ones you're familiar, like physios, pharmacists, radiographers, right? But we also have the smaller specialized ones, like podiatries, and also genetic counselors, and what else? Oh, like play therapists, music therapists, right? So what do I do in my portfolio at the cluster level is that we work with the different professions, right, to develop their career path. Okay, so we have a structure for career development in management, in clinical, in education, as well as research, right? So that, for all the AHPs, we call Allied Health Professionals AHPs, right? After the first few years of building their clinical foundation, right, they have the opportunity, right, to go into different career paths. And, and together with it comes training, opportunities to move around the different areas, the different institutions, right, for exposure and growth. Yeah. So, well, that's my sort of brief sharing, and happy to share more later in the Q&A section. Thank you.
Thank you, Ms. Tan. Now I'd like to invite Mr. Clement to give your sharing. Mr. Clement, please.
Hi guys, my name is Clement. It's a real privilege and joy to be here with titans of the profession. So I just realized that when B first got her scholarship, right, I wasn't even born. So I'm 32 this year. I am married, and I've been a OT for about 6 to 7 years. It's actually very nostalgic because if you go to the AIC booth later, right, Lynn, who is managing the AIC booth, was one of my scholarship officers. So I've known her for 12 years. So it's extremely nostalgic for me. So that's a little bit about me, but I realize I don't know much about you guys. So maybe I'll get to know you a bit better first. How many of you all have decided you want to do healthcare? Okay, great. How many of you are still deciding whether or not to do healthcare? No. Perfectly valid. No right or wrong answer. Okay. How many of you guys are 17 to 25? Most of us. Okay. Anybody from 25 to 35? Yeah. Okay. Parents? Great. Okay. Lovely. So reason why I ask this is so that I can meet your needs and to understand what we are all looking for. The reason why I asked whether or not you are deciding to go into the healthcare profession, right, is simply because it wasn't very clear-cut for me. I happened to stumble into healthcare and I loved it. So I didn't have a very direct calling, right? I mean, everybody says, wow, you need to know what you need to do when you're 18, and then suddenly, boom, out comes a 17-year career and you're fantastic. That wasn't my journey. I didn't know what I wanted. I had to ask around, and eventually one of my friends said, hey, have you considered healthcare? So I hope that, I don't have such an illustrious career like the rest of them, but what I hope to share with you is my personal reasons for why I decided to join healthcare and the current role that I do. So please bear with me. Okay, how do I? Okay, great. So a little bit about myself, right? I am currently a team lead for the OT department, and I'm at St. Luke's Eldercare. I work with clients who have stroke, dementia, orthopedic conditions, and hand injuries. When I first received the scholarship, I was posted to Ng Teng Fong Hospital, where I was in the orthopedic and surgical wards for quite a while. I did a few rotations in different subspecs, and I decided that I loved looking at broken bones. I love broken bones. When okay, of course, not looking at the person with broken bones, right? But looking at X-rays, understanding how to fix it. I had very compassionate surgeons who allowed me to observe their surgeries inside the operating theatre to help me get an understanding of what the patient is going through, and also how best to help them and appreciate the kind of challenge that they go through, lah. So after 6 years of being in the wards, I have transitioned into community care. And what I do is I give rehab to people who have come out of the hospital and are still recovering from conditions. What do I mean? So, for example, I'm sure all of us have had fever or flu in some way, right? And some of us have had COVID, right? And it leaves you very fatigued, deconditioned. So sometimes you go out and you're just short of breath, very tired, right? But you're medically well. My job is to make sure that you can train to go back to what you used to be doing. So for example, you want to be cycling, you want to be working, I condition you to do that. Who here knows what occupational therapy is? Okay, lovely. But that's, okay, Nigel's from MH, so he's disqualified. Anybody else knows what I do? Okay, very good. If you don't know what I do, it's a good thing. Because if you know what I do, you either have a colleague or a friend who is an OT, or you have had somebody in your family who has had significant loss of quality of life. And so that's a bit of what I do. So OT, right, essentially, we deal with patients who struggle to recover the ability to do day-to-day tasks after an illness or disability. And what we do is we develop treatment programs to help them to be able to relearn those basic skills. What exactly do I mean? I think, let me just give you an example, which I'll share a bit later. This is my very short and exciting journey. So the rest of our speakers have had like 8 to 10 different tabs, right? I only have 4. Okay, so I received the MOH scholarship when I was actually still in army. I wasn't a straight A student. There were people who were much more accomplished than I am, and in fact, a lot of my friends got the scholarship before me. And I remember that I got the fateful call from MOH when I was actually out in the field, and my phone rang. And I asked my officer in charge, sir, do you think I can take this call because it concerns my future? And he said, please go ahead. So that was about 7 years ago. Oh no, more than that, much longer ago. After that, I had the privilege to be sent to university in Australia. So for those of you who have you all been to Perth before? Anybody been to Perth? Okay, not really. Perth is a very nice place to hike and interact with nature. So I studied in Perth for about 4 years in Curtin. Subsequently, when I came back, I was in Ng Teng Fong General Hospital, and now I'm very privileged to be in St. Luke's Eldercare. So again, right, I think the question that I want to raise, right, for those of you who haven't decided why you want to join healthcare, is your reason. As I mentioned before, I stumbled into healthcare because I didn't actually know what I wanted to do. There's so many different professions, right? Tons of booths out there. I decided that I wanted to be in healthcare because I wanted to make a direct difference in the lives of people. So one of the most notable experiences that I've had the privilege to have was working with a particular gentleman from Australia when I was in Australia, I was having an attachment at what we call the Brightwater Slow Stream Rehab. And they deal with people who have had very, very bad strokes. What I didn't know was that this gentleman that I happened to interact with, he actually was a CEO of a very large company. He told me that on Father's Day, he was cooking a barbecue on a grill. He blacked out and he woke up in hospital 2 weeks later only to find that his body was half paralyzed and that his wife had left him because she said, I didn't sign up for this. He couldn't walk, he couldn't use his right hand, and his goal was to be able to put on a shirt, to shower, and to cook for himself, and that was it. And I remember a time where we were actually putting on a shirt, just like this one, the ones that you and I put on every day. And it took us about 3 weeks to be able to get him to put on the shirt independently. When he put on the shirt, he cried for 5 minutes and he said, this is harder than being a CEO of a company for 20 years. Corporate life is hard, but my rehab is harder. And he looked at me and he said, thank you for helping me to achieve that small bit of independence that gives me quality of life. That never left my mind. Eventually, he would go on to be able to shower on his own. He will actually go on to be able to cook. And he is actually Googleable. So if you type in the name Mark Elsing, his story is actually written there, if you're interested to find out. And such journeys are not uncommon. They are hidden away in the lives of ordinary people. But when we do get a chance to interact with them, and I'm sure I speak for all my colleagues here, that when we see the difference and the progress that they make, that is what keeps us ticking and going to work every single day. And of course, there's going to be good days and bad days. Healthcare is obviously not a walk in the park, right? But that doesn't deter any of us from doing so. In fact, the more challenges you face, the better you will come through. So those are the reasons for why I decided to join healthcare. And I'm just going to leave it there. If you want details regarding OT, and St. Luke's, I'm very happy to take questions. But I hope that this has encouraged you a little bit better and helped you to define what it means when you want to find a reason for joining healthcare. Thank you so much.
Thank you very much to all four of you for your wonderful sharing. So now we'll proceed with the Q&A segment. So I'd like to invite all four of you to take this white chairs here. Just sit at the white chairs here, then I'll just join you all. So there are two ways in which, actually any order will do. It's fine. It's all right, yeah. So there are two ways in which you all can ask your questions. Number one, it's the pigeonhole. So, sorry, can we have the QR code? Yeah. Or alternatively, you all can raise up your hands and then we will take the questions directly. Yeah. Okay. Yeah. You all can spend a minute or two just to post your questions, or if any of you are comfortable just raising up your hand and giving your question, by all means also you can do that. Okay, so maybe first we will ask anyone who would like to just raise up your hand and ask any questions before I go to the pigeonhole. Anyone? Any questions? No? No? Okay, so I'll just go to the pigeonhole first. Okay, so there's one question with like 11 votes. So what is the job scope for nursing? So perhaps we can have our APNs to share a bit about the job scope.
Yeah, yeah. So I think it also depends on which area you're working in. For instance, in the area where I'm in, we do a lot of assessment and monitoring of patients when they are in the community. So when we do the home visits, we assess them. And they can be very comprehensive assessment, physical assessment, or through history taking. Thereafter, we also look at some of the issues that they may have, and then we think about ways on how we can help them. For instance, if a patient has a wound, then we would recommend wound products to apply for this patient, and we also teach the caregivers and family members on how to apply this wound and when to change and things like that. And we also do a lot of patient education to teach the family members and the caregivers on how to take better care of the patient's conditions. And sometimes we also do procedures in the community setting. So yeah, we do many things, right? But that's in the community. In the hospital, of course, the job scope is slightly different. Of course, if you're in the acute sector or if you're in the ED, then you'll be doing carrying out various orders, instituting treatment, administering medications, many things. Yeah, maybe Veronica, would you like to add on?
So I'll probably add on to the inpatient. You can hear me, right? I'll probably add on to the inpatient sectors. Inpatient department. So that means wards, for example, or even clinics. So very much like what Shufan had mentioned, our primary role is to actually assess the patients, ensure that the evaluation of patients are correct and timely. To also aid our colleagues, like our allied healthcare professionals, our physicians, to also carry out orders and also to be a part of the patient's recovery process. So, like I've mentioned earlier on, we also do partake in research, if you guys are keen, and also things like competencies across the continuum of care. So, besides the basic care, so I'm not going to sugarcoat the whole thing. Nursing is very much hands-on. It's very much skills-based. We all start from basic. We have to start learning how to do the basic care, which is sponging the patient, turning the patient. Basically, sometimes these patients can lose the ability to care for themselves, and our role is to help them. Yeah, so we do. Some people would like to say in the past, some people will say, "Oh, this is a very dirty job," but I always tell my nurses, even cleaning the backside tells you a million stories. Different type of colors and shapes of the feces tells you a different thing every time when you clean the patient. So even cleaning the bums of the patient is also a learning process. Yeah, so that is it, and also wound as well. We follow the physician rounds. We also partake in contribution of the patient's well-being during the medical rounds. So, for example, when the doctors do their rounds, we are the nurses that will be there with the patient majority of the time. So anything that is wrong with the patient, we are the advocates for the patients as well. Yeah. So and on top of that, like what Shufan have mentioned, and in the outpatient setting, let's say clinics, for example, our role entails of phlebotomy. That means we take blood for the patient, we administer medications for the patient, same for the inpatient. Largely, education is also one of our major job scope. We educate the patients for better lifestyle management, chronic disease management, and care management in general. Yeah.
Thank you so much for the sharing. Okay, actually, for your next question, okay, actually they targeted to a nurse, but I'll just modify the question a bit. So, how do you handle the scenarios where patients or their families shout or do not cooperate with you? So, it can even be maybe from an OT's perspective. How do you all handle such situations where you might have some tricky patients? Yeah.
I think in masters we were taught there is a course particularly on how do you manage difficult conversations, be it breaking bad news, be it handling very aggressive patients. And I think the healthcare system in schools are now actually and incorporating this component of these communication skills into the curriculums. How do you manage them? I think ultimately the patient just wants to be heard, right? So at the end of the day, when they are throwing a tantrum or they are being very unreasonable, there must be a reason why they are doing so. And ultimately, they just want to be heard. So if we are able to get to the root point, the root cause of what's causing their unhappiness, and we can address them, then I don't think that's a problem. But how do we get to that stage, right? It takes a lot of practice and patience and active listening. You need to really listen and not judge, because it's very easy, right, for us when the patient starts quoting you all the profanities and start saying things that you're stupid, of etc. etc. So you tend to be very affected, right? So the key here is to be not affected, to be taking yourself out of the equation and looking at things at a bigger perspective and see how best can I help the individual. Yeah. So ultimately, the aim is to how do we help this person, lah. I'm sure the same.
I think I will echo Veronica's sentiments. So, if I may share an experience, I think there was once I actually visited this lady, and she had a very, very steep functional decline because of an accident, and she could not walk anymore. And I was just giving her education and talking to her about condition, giving her the information and things like that. When suddenly she burst out and she started screaming, and she just said, "Get out, get out! I don't want any healthcare worker in my house," things like that. And what I actually saw, it's very easy to react and think like, wow, this lady, wow, I'm very scared. Wow, she screamed at me like that. It's time to back off, But I think there was an intuition within me that saw that she was someone who was hurting and that she was in a lot of pain, and she just couldn't, she couldn't accept, the state that she was in, that she is now a patient. She just simply could not accept that. And therefore that led to the screaming, the shouting, the crying. So what I did was just very gently, I go to her bedside and just held her hand. I just held her hand and I just gently stroked her and said, I'm here for you, yeah? I know that you're going through a lot, and I'm here for you. I know you're suffering, and just to tell her that, that we empathize with her. And she softened and she started tearing. Yeah. And then she started sharing with me about, how tough the past months have been. And actually later on, towards the end, she actually apologized about that outburst. Yeah, but there was also therapeutic communication involved, and through the sharing, about her anguish, about her pain, she also had a bit of release. And so that was also good for her. So yeah, it's really about looking beyond, and not react to a difficult circumstance when it happens. Yeah.
Hello. Maybe I'll just add on to that. So we do have training with regards to the techniques of how to handle conversations, right? But I think personally, it also has to do with being both gracious and truthful at the same time, right? What do I mean? So there was a particular instance in the hospital where I was teaching the helper of a person who had lost a leg how to bring her to the wheelchair, and so the husband, who was 80 years old, he was just observing, and he said, I've got very bad back pain lah. So I told him, Uncle, if that's okay, why not you observe? Are you happy to observe? And I'll teach your helper how to do that. So after that was done, maybe an hour later, there was some shouting from the cubicle, and then I realized that this man was yelling at the helper, and he was yelling at her and saying, "You are my slave. How dare you talk back to me?" And so he was shouting at a very loud volume, and I went to him and said, "Sir, is anything the matter?" And he looked at me and said, You are the one who taught my slave how to talk back to me. I want to speak to your manager. And so I had to tell him, "Sir, it's not appropriate for you to speak that way. Maybe we could talk about this in another location, but there are also 5 other patients who are resting alongside your wife, and maybe I think it's it's good for us to be able to move." And he actually didn't back down. in the end, like all the rest of them said, you don't have to take it personally. But I did have to enforce boundaries and tell him that, sir, I apologize. I may have to call security because our patients need our rest. So eventually, when security came, he actually calmed down and explained, like what Shufen said, there were a lot of struggles that were in his heart. And at that point of time, you can't agree with everything, right? But you can be still gracious, but truthful at the same time.
Okay, maybe I'll chip in here as well. Add another perspective, to how we interact with our patients, every day. It's not about, asking, what's the matter with you, right? But what matters to patients and their family, And when you're able to establish that, right, then it's something common that you want to work towards. So if I can just share, my experience, something that happened that, has always stayed with me is when I was still practicing as a physio, and like I mentioned, I work with patients after surgery. So there was this patient that, she had a big op, and then I went to her, right, wanting to help her out of bed and start moving, start walking, right, for her first walk. And, like a good physio, I get ready everything, right, walking frame, right, make sure she has her shoes, make sure she's wearing her baju properly, right, clear the room of obstacles so that she doesn't trip and fall. And then when everything is ready and I ask, okay, auntie, right, are we ready to go? And she said, wait, go to the drawer, take out my lipstick. Yeah, okay. Because I want to look good for my first walk after surgery, going out to the public. Yeah. So oftentimes, we are just concerned with what we need to do as a professional, right? But what is the thing that's going to motivate the patient is what's going to get them moving. Yeah. Thanks.
Yeah, thank you very much for the sharing. I think even as students, we also encounter a lot of patients. And I think at a very young age, I think one of our concerns would be how are you going to handle? So if that is something that's stopping you from entering the industry, I hope their perspectives kind of could have enlightened you a bit and makes you feel more courageous to step forward into this noble profession. Okay, I think.
Can
Yeah,
I add?
Sure, yeah.
There's always safety precautions taken. So do not be afraid that, it's all about learning how to talk. That's it. No. If, let's say, the patient do get aggressive, do get violent, we do have an escalation protocol in place across all hospitals to safeguard and protect our staff. Yeah, be it any profession. Yeah. So we do have those. So besides the communication to de-escalate the situation, but we also have safety precautions as well. Yeah.
Thank you very much. Yeah. Shah, now I have quite an interesting, quite a heavy question. What challenge is the healthcare sector facing now, and how will I, as in a student, be developed to face them in the future? Yeah. So maybe, Ms. Tan, maybe you can give your perspective from a management point of view.
Yeah, I don't know where to start. Yes, I mean, healthcare in itself is already a challenging job, like, my fellow panelists have shared. Something that you need a lot of strength. I mean, not just because of the physical aspect of it, right? But emotionally, right? You need to be very strong. Of course, intellectually too, because you need to, be quick to think on your feet, right? Know what is troubling the patient, and then know what you need to address. But I think the other thing is that, with our aging population, people living longer with chronic, conditions, the rise in healthcare demands, really, needs a lot of input from our healthcare workers. And you always feel that there isn't enough around, right? Yeah, because so many things to do, not just about taking care of patients, right? But also doing teaching, right? So that we have the future generations of healthcare workers to come, right, to continue to care for our population. And also, all the opportunities to do research and all that, so that you find new ways, right, better ways, more efficient ways to treat and manage patients better. So there's all that, and the school worked very closely with the industry to find out what is needed, right, so that they prepare you, right, in school, right. There's also clinical training, right, where the students come out to the different settings, ranging from the hospitals to community settings as well, right, to get that exposure early, right, so that when you come out, when you graduate, you come out, right, you're sort of ready. But of course, in the early years, you still have your seniors, right, to guide you along, mentor you, right, and then together work as a team, right, with the doctors, the nurses, the other allied health professionals, everyone working as a team to overcome, these challenges. Not sure if anyone else wants to add to that.
Yeah, maybe I'll add. One of the things that we definitely face is a shortage of manpower. And I don't mean, I really don't mean that we don't have enough hands individually and things like that. But it's also about finding people who have the heart and the skills to be able to deliver the kind of care, right? I mean, if you come into healthcare for looking for very good remuneration, right? You're not going to earn as much as, say, your financial colleagues. And very quickly, you will discover that if you come in for money, you won't last. So what I mean when we say we lack manpower, we lack people who really have both the heart and the skills to be able to care. So if you do know that, you have the ability to relate, you really, really do have a desire to care for people, that's something that can be nurtured and should be nurtured. And I'm sure that all of my colleagues here would agree that if you have such a desire, all of us will be able to help you to nurture and grow your careers as you step into the profession.
I think one advice I would give also for budding healthcare workers is that, the going is not going to be easy, especially in your especially for me, in my early years, it was very, very tough. But I would encourage you to be resilient, to remember that first love for why you chose nursing or to be in the allied health profession in the first place. Because at the end of the day, like what Clement shared, healthcare is not going to pay as much as in the financial sector, but what really keeps us going every day is the joy and passion in seeing our patients get better, seeing them have improved quality of lives, and that they're out of the hospitals and thriving happily in the community.
I think to answer the question as well, in nursing per se, what is really short, what is the challenge that we have is truly the manpower situation that we have. I think that is worldwide, not just in Singapore. But we are having career fairs like this to show you guys, what we have to offer, and to also, of course, get you to hopefully inspire you to come on board the profession. And how are we preparing you for this is, of course, intakes, we are increasing, I'm sure schools are increasing their intakes for courses, and they are also encouraging, they are also giving out sponsorships for patients, for nurses or aspiring healthcare professionals who wants to join healthcare, but yet they lack the finances to do so. And on top of that, like what Ms. Tan have mentioned, chronic diseases are also up and coming. So curriculums are changing towards that aspect. It's going to be more generalist led across the setting. So therefore, you are more prepared to manage this group of patients when you come to the workforce eventually. Yeah. Okay.
Thank you very much for the sharing. Okay, at this point, I can ask anyone has any questions they want to raise up and ask, or I can move on to the pigeonhole again. Any questions from the floor?
Parents got any question?
Yeah, you can feel free to ask as well. Yeah. Anyone? Nope. Okay, so we'll just go for a couple more questions in view of time. So I think this question is mainly for Mr. Clement. How is physiotherapy different from OT?
Well, that's an excellent question. I answer that every single day. The physios primarily look at strength and walking, right? B can talk a bit more about that. What I look at is helping the person to return to activities that may be meaningful to them. So, for example, if for example if we had a client who had a stroke and he wants to be able to return to being a teacher, right? What we will be doing is to actually get him to type, get him to be able to write, and sometimes even work with the school to say, your teacher wants to return to work. How can we actually make the environment a little bit more friendly? So we work with our different partners to be able to do those things. Of course, this varies in scope and in size, but the long and short of it is we try and see what the person enjoys and wants to return to in terms of meaningful activity. And then we try to restore that, be it driving, be it going back to being a gym instructor, be it going back to being a teacher. We try to gear our activities to returning to what they consider to be meaningful. So not so much what we want to do, but what they would like to do. Yeah, so maybe you can share a bit more about what the PTs do.
Yeah, it's often asked questions, what's the difference between a PT and an OT? I mean, maybe I share from the community hospitals where I am, where the physios work very closely with the OTs alongside, right? So physios typically is, say, after an injury, right? Maybe you fracture your arm, okay? And then thereafter, the physios will work on restoring the range of the joint, right? Yeah, so you get the range back. And then OT will take it from there, right? Now you have the range, you can do the other activities like showering, cooking, feeding themselves. Yeah, so this is how, the two professions work closely together. So sometimes, yes, there are areas where we kind of like, merge, but really, it's what is the goal we want to achieve for the patients, right? And then how can we do it together? Yeah, so that's one aspect.
Hope I answer your question. If you want me to go into detail, please see me after this.
Thank you very much. Okay, just one last question, which I'm also curious about. How do you all have work-life balance? Yeah, because I mean, healthcare itself is quite busy, right? So just from at least from a student's point of view, I think even parents and students are also keen. Like, how do you ensure work-life balance in your careers, in your respective careers? Yeah, maybe we can just have each of you just share a quick one. Yeah.
Me and Clement were discussing this earlier. Yeah, I'm not going to lie to you. Of course, in healthcare and actually in any career, whether in the financial, tech industry, you're going to need to find work-life balance. Yeah? And I think finding that work-life balance is actually part of growth. Yeah, it's part of a personal growth. I think after a while, you will learn to realize that to continue the momentum, to continue to sustain, you need to find time to give yourself rest. You need to set certain boundaries. So, it's simple. It's things like even just being, trying to be more efficient at work and trying to finish whatever you need to finish during your work hours. And, setting a simple rule like, I'm not going to bring work home after, office hours end. Yeah, so it's things like that I learned along the way. Yeah.
Adding on to what Shufen said, right? I used to be guilty when I said no. So one of the things that you'll get next time, right, is that when you do your job well, more responsibility will be added to you because of the trust that you are given. So what I used to do was say yes to everything because I wanted to, I wanted to prove that, wow, I wanted to, fulfill the trust that was given to me. On hindsight, I realized that, that might not have been the wisest thing. And I learned very quickly that, when you say yes to many things, I overstretched myself quite a bit. And I ended up feeling very sorry for myself. And then I also disappointed the people that had put trust in me. But I had to learn how to realize that, look, that the work was there before I came. The work would be there long after I'm gone. And there is only a certain time that I'm given. And I'm going to do my utmost best with the things that I'm given. So you have to decide for yourself what you want. And like what Shufan said, if you want to be the best, right, time has to be spent. And that's a commitment that you will have to learn to seek, and also to learn to practically balance your time as things are, because we all have different responsibilities for family, at work, and so on and so forth. So drawing boundaries is definitely something that we do very actively. Yeah.
Okay, so I mean, whatever the two have said, I also practice it lah. So I won't add to that. But just to say that staff wellness and burnout is topmost in all the healthcare organizations right now and across all staff groups. Because we acknowledge, right, the challenges that our staff have to face every day. So we even have a chief wellness officer, right? So at the workplace, we make sure that staff do get rest breaks, right? So that they can, keep the energy up throughout the day, so that they still have energy after work, right, to do things that they enjoy outside of work. The other thing is, introducing, different activities during the work, right? So that staff can also find something that they enjoy, right, during work time. So like yesterday, my workplace, they had a towel art workshop, right? So staff actually went to, during lunchtime, go and, do something, right, that is away from patients. So that's how we try to achieve, some of that sort of work-life harmony at work, right? And so personally also, I mean, time management is one. Knowing how to pace yourself is one, right? You can't always be at that high level. So you do need to step back, do something that you enjoy. So for me, I go to the gym, and do some exercises, work off the stress, and then keep myself fit at the same time. Thanks.
I am still learning how to achieve optimal work-life balance. I find it very challenging. It's not easy, but for my sanity and also for my marriage, yes, it's important. But I think drawing the line is important. Setting boundaries, setting expectations, making your expectations clear is important to actually draw the line. I always worry that, if I'm off day on a weekday, then my patients how? Who's going to follow up? If something happened to them, how? So, but we have a structure in place whereby we always have a second person, a successor to actually carry on the good work, right? So healthcare is 24 hours. It's never going to stop. And there's always going to be someone who's going to help you. So I think it's a teamwork that we have at every organization. Yeah, so, but like I mentioned, like all they have there mentioned is challenging. It takes a while to practice. Yeah, that's all.
Thank you very much. Okay, I think, since we're running out of time, so on behalf of the MOHH team, we'd like to thank you all for your wonderful sharings. I hope that these four of them would have inspired you all in one way or another to take up a healthcare profession, whether it's nursing, PT, or OT.